Dr. Brown, what is your profession in the medical field?
I am a gastroenterologist. I specialize in diseases and disorders in the digestive tract. I am certified as an internal medical doctor, therefore I can perform surgeries.
What is it that you do in surgery as a gastroenterologist?
I perform surgeries on functional dyspepsia and irritable bowel syndrome, cancer and liver disease, hepatitis. During surgery I use an endoscopy, which is a long tube wire with a small camera at the end. That is long enough to go through the whole digestive tract. I use endoscopies to see if patients have an ulcer, cancer, or inflammation anywhere in the tract.
So, what's the matter with this patient?
His name is Rick Jr. and he has inflammation and internal bleeding in his small intestines. I have to use an endoscopy to see where I am working.
For those young and curious adolescents out there looking into the medical field, what type of education do you recommend?
So, to become like me, to become a gastroenterologist requires many years of schooling and training. You need overall good grades in high school. In university, you would need to graduate with a Bachelor of Science degree. You must obtain a medical degree from an accredited medical school. The next step is to complete a residing program in internal medicine. Then you need to become a certified physician to start studying gastroenterology. You need the knowledge, practice, training, experience, and technical skills, but the most important of all is you need an active medical license.
Wow, that's a lot of years of education. Is it all worth it?
Yes, indeed, it is. I don't have to work in the hospital or surgery room all the time. I own my private business where I can talk to my patients one-on-one. It is sometimes good to work in the office and take a break with the surgeries. I can also hire other physicians like a hepatologist.
What is the average workday like?
There's no average workday in this career. You have to be pretty flexible. There's no set routine. One day I will be performing a surgery, the next day talking to my patient, the next figuring and analyzing data, the next training students, that night working at a night shift at the hospital due to emergency situations. The next morning, driving my kids to school. Let's just say I'm pretty occupied.
You're very busy. I bet all that studying and work leads to a golden paycheck. Am I guessing?
Oh, yeah. You know enough for my Lamborghini. My mansion, my own company, and a cottage in the Bahamas. Oh yeah, I forgot about my castle in Italy. Oh yeah, enough to keep me going. I get roughly 775, 1,000, but there are gastroenterologists who only make $500,000 a year. But you know, I'm pretty good at what I do.
Thank you very much, Mr. Brown.
It was a pleasure.
Well, there you have it, folks. Everything you need to know about a gastroenterologist with Mr. Brown. This is Muriel Farmer from CBC News.